Hi, I'm Laura Ramata, and this is my presentation on atypical development, intervention, and treatments in the cognitive developmental domain with emphasis on dyslexia. Studies by many early child pioneers over the past century has made it possible to realize a pattern of growth and development in early childhood. Age appropriate skills, also known as developmental milestones, are used to determine a child's progress. Children whose development deviates from what is considered normal is said to have atypical development. At some point in time, most children may take a little longer to complete a task, and not all delays are confirmation of a learning disability. The National Center for Learning Disabilities emphasizes the importance of ensuring that there is an actual difference in the quality, form, and function of the skill, and it's not just delayed. According to the Learning Disabilities Association of America, some common signs of it that a child may have a learning disability include short attention span, poor memory, difficulty following directions, sensory difficulties, fine motor skills difficulties, inability to discriminate between letters, numerals, and letter sounds. Student in my class has been displaying inadequacies in introductory reading skills. She has been having difficulty recognizing letters, and their letter sounds. She also struggles greatly with rhymes. I suspect that she may have a cognitive developmental disorder known as dyslexia. Her hearing and vision was tested and proved to be healthy. However, further inquiries informed me that her father also struggled with reading. Join me as I explore this disorder and investigate it in relation to Trinidad and Tobago. I will discuss diagnostic methods and evaluations for children with dyslexia locally and internationally. We will also examine intervention strategies which can help my students and their family as they battle this disorder and its effects. Dyslexia. Dyslexia comes from the Greek word dys meaning difficulty and lexia meaning word. Essentially, it's a neurobiological disorder which denotes difficulty in reading, spelling, speech, and numeracy according to WebMD. According to the National Center for Learning Disabilities, dyslexia can occur as a result of inadequate development of the left hemisphere of the brain, which occurs in the 6 months of fetal gestation. It can also occur as a result of other developmental disabilities and has a high risk of occurrence if a family member suffers from the same disorder. Take a look at the brain. Here we have a dyslexic brain as opposed to a non-dyslexic brain when reading is occurring. In the human brain, the parietotemporal area, occipital temporal area, and Brachy's area are all activated when reading is taking place. However, in the dyslexic brain, only the Brachy's area is activated. This means that there is no analyzation of new words, and spelling and pronunciation and meaning of the word is not processed or stored. Cognitive psychology tells us that the brain is like a computer. It requires input and it stores, processes, and output information. Inefficiencies in the processing and storage can result in faulty or no outputs, resulting in learning disabilities. Piaget's cognitive developmental theory focuses on child development in 4 stages. It is the second pre-operational stage between 2 to 6 years old that language development takes place. Evidence shows that screening for dyslexia is most suitable during this stage. It is in these preschool years that the signs and symptoms of dyslexia becomes apparent. In the final or formal operational stage occurring from 12 years old, children with dyslexia is more able to adapt to function better with their learning disabilities by diligence and perseverance. In addition, psychologists today mention some symptoms of dyslexia. It includes learning the difficulty or delays in learning the alphabet, learning to speak or read, pronunciation, discerning one letter from another, distinguishing left from right, learning to spell, concentration, and numeracy. Dyslexia also has long and short-term effects on socio-emotional health. It can cause frustration, anxiety, alienation, depression, feelings of worthlessness, and bullying. In Trinidad and Tobago, there are no specific statistics for the occurrence of dyslexia as there are no regular testing and recording of dyslexic cases. However, an approximate figure of 10% of the population being dyslexic was derived. The teacher-child ratio in the classroom makes it difficult for the teachers to detect or intervene in cases of atypical development. As a result, a lot of cases go unnoticed and untreated. In Trinidad, we have two organizations which focus on dyslexic disabilities. This is the Dyslexia Association of Trinidad and Tobago and the Morris Center Trinidad Limited. Teacher suspects dyslexia in a child. First, he or she recommends the child to the guidance counselor, who then informs the parents and directs them to a professional for screening at a private institute. Assessments are then performed and recommendations are made for treatment. A trained teacher or clinical psychologist carries out a series of tests on the child for evaluation. In Trinidad and Tobago, we use the Wechsler Intelligence Scale for Children, the Wechsler Individual Achievement Test, and the Comprehensive Test for Phonological Processing. Similar tests are used globally, which seek to identify the child's ability to input, process, and store and output information. David Percy in 2018 explains that all aspects of reading process are carefully examined. Here are some diagnostic techniques used globally. Early identification of dyslexia is crucial as there will be a greater possibility to aid in management and coping of the difficulty. One strategy I will use is a multisensory structured language. According to Smart Kids with LD, MSL can be incorporated in mainstream language arts and can be performed individually or in small groups. It entails the use of listening, speaking, reading, and writing in conjunction. A representative of the Dyslexic Association of Trinidad and Tobago advised me that this method is very efficient. Dr. Gavin Reed also stated that multiple research has proven that this method is most beneficial to children of varying ages and classroom settings because it uses this technique where you hear it, say it, write it, and see it. In addition, I will also implement phonemic awareness. Phonemic awareness is the ability to recognize and differentiate the individual sound units in words spoken. It is a foundation for reading and spelling. Phonological awareness is the strongest predictor of reading progress, according to Stanovich, as cited by Dr. Gavin Reed. More recent studies have demonstrated that phonemic awareness skills influence children's broad academic success throughout most of their schooling. I will initially begin by teaching beginning letter sounds, middle sounds, and end sounds. When that is mastered, we'll progress to rhymes. Rhyming is very important in early reading. Rhyming reinforcing letter sounds allows manipulation of the letter sounds, improves writing skills, and expands imagination. Early intervention and treatment has resulted in 95% of children being able to keep up with their classmates. This means that the learning gap is narrowed and it can even disappear, and it makes learning easier on the child, and progress from one level of education to another will be more manageable. 70% of children who receive early intervention become proficient readers. Most interventions focus on phonological awareness, structured reading schemes, and measured introduction of new words. This helps the child to master reading. As a result, the child's overall learning is improved, which positively affects the child's learning outcomes and quality of life. Early intervention will also reduce the social and emotional struggles of children with dyslexia and aid in promoting positive self-image. The frustration, anxiety, and stress that comes with difficulty reading and completing daily tasks becomes unbearable. In some cases, dyslexia is mistaken by parents and teachers for laziness. Then there is blaming and shaming. Awareness by the parents and the teachers will reduce this, and more patience, tolerance, and compassion can be displayed towards the child. Learning how to cope with dyslexia at an early age reduces the feelings of being abnormal or unintelligent. Being emotionally healthy is important in early childhood development. It will increase self confidence, improve self esteem, and lower the risk of depression in childhood and adulthood. Atypical development hinders a child's ability to thrive at a pace which allows the child to achieve age appropriate milestones. Dyslexia, in particular, disables the child's ability to read, comprehend, which is the basis in all learning areas. Early detection and intervention proves to be crucial in the child's future learning outcomes. More attention should be paid to the child's pre-reading skills by caregivers and teachers, as children who demonstrate inefficiencies in phonics in early stages tend to have dyslexic tendencies in later school years. Children who have difficulties learning need to be treated with patience, empathy, and compassion. They need support to be able to cope and manage their symptoms. Dyslexia not only affects a child's ability to learn, but it also affects their social, emotional, and mental health. Untreated dyslexia widens the gap and disadvantages the child at present and in adulthood. Our children need to be given the best opportunities to grow, develop, and learn so that they can achieve their full potential. Doing this project has opened my eyes to the plight and struggles that children living with learning disabilities face daily. It truly affects all aspects of living and learning. I was especially appalled at how little is being done in the public school system in Trinidad and Tobago to assist kids with learning disabilities. It really impacts mostly on the kids of lower economic status. Also, there is such a lack of awareness of dyslexia in Trinidad and Tobago. It is quite shocking. This has motivated me to want to specialize in special education so that I can do my part to help these little ones achieve their full potential.